Hey everyone, it's Dr. Sestar again with Palm Beach Cosmetic Surgery. Today I'm going to talk to you about facelifts.
What is a facelift?
A facelift is a pretty common procedure in terms of aesthetic and cosmetic surgery. It's a procedure whose goal is to give the face a tighter, more youthful look, and we do this by repositioning both the skin and the deeper tissues, it's called the SMAS, to get rid of deeper wrinkles, skin drooping, and skin laxity that one acquires as they get older.
Is there only one type of facelift?
For all intents and purposes, there's three major categories of facelift. There's a skin-only facelift, where you simply lift and reposition the skin of the face. That doesn't have really durable results. It doesn't last too long compared to the other two types. There's something called a SMAS facelift, which is the next plane of tissue beneath your skin. That is the majority of facelifts that are performed because it gives pretty durable results, and it's not too invasive, and there's a trade-off between the invasiveness of the surgery and the safety of a surgery. And also the most invasive and the most durable in terms of results is something called a deep plane facelift. If you've Googled facelift, this is probably the one that people like to mention because it's the most invasive and gives the most drastic change before and after surgery, but not everyone necessarily needs that in order to be satisfied with their result.
Where are the scars for the facelift?
Majority of the time they follow the same pattern depending on the surgeon that you go to. They start right up here, right at your hairline. The incision travels around this tuft of hair right in front of your ear. It follows the natural crease of where your ear takes off from your face in front of your ear, and it swoops around your earlobe, goes back up behind your ear, transfers over to in front of your hairline behind your neck, and then we extend the incision downward onto the back of your neck depending on how much tissue we need to resuspend.
What should I do before getting a facelift?
There's a few things you have to keep in mind, especially in the few weeks leading up to your surgery. 2 weeks beforehand, you want to stop medicines that are going to thin your blood, like aspirin, ibuprofen, fish oil. If it's a prescription medicine that thins your blood, you need to coordinate with the prescribing doctor to make sure that you're not at risk if you stop that medicine. You need to abstain from all nicotine-containing products. This includes cigarettes, gums, Zyn pouches, vapes, definitely. This definitely affects the blood flow to the tissue, and when you undergo a facelift, the skin that is repositioned right near your incision is at risk for ischemia, lack of blood flow, and that is exacerbated by the use of nicotine.
What do we need to know about the healing process? Is there a secret?
So the one rule that I can always give is, if you are concerned or curious, contact your surgeon. That's why I give out my cell phone number for patients to reach out to me personally. Because when you come out of surgery, it is not going to look the way you expect it to look. It's the healing process that eventually results in the final natural look of your facelift. There might be some bruising, there might be some unevenness, there will definitely be rippling or quilting or plicating, folding of where your skin attaches to the skin in front of your ear. This is not going to look natural, especially in the first week following surgery. It's the healing process that ensues in the weeks to months after your surgery that it's eventually going to result in the most natural final outcome.
When can I expect to look natural?
The number that I give everybody is about 3 months. Some people before that, some people after that, but you're approaching your final natural outcome by about 3 months.
Can you give me an example of why I would need to reach out to you?
I prefer you reach out to me with any question at all. I prefer to hear from you personally rather than you wait until the next day and say something like, oh, I didn't want to bother you. There's a reason I give out my phone. I want you to tell me how you're doing. But there are some things that are more worrisome than others. A fever, a new symptom that you didn't experience immediately following surgery, active bleeding, darkening of the skin, especially around right in front of your incisions. These are all things that I would like to know rather than wait until the next time you see me.
Do the stitches dissolve or do you have to take them out?
This depends on the surgeon. It depends on what they're used to. Some surgeons use staples, especially behind their ear. Those will come out at about a week. I use dissolving stitches, and even though they're called dissolving stitches, they don't dissolve 100% of the time, so it's not uncommon that most of them will fall out on their own, but I end up needing to take out 1 or 2 stitches. Normally I do that at the 1 week appointment.
When can I resume my normal skincare routine, including moisturizer and makeup?
So it depends on the product that you're going to use. Definitely abstain from putting anything on your face other than Aquaphor or Vaseline for the first 4 days following surgery. Your moisturizer you can start using after you halt the Aquaphor and the Vaseline. Again, that's on day 4 normally. I would refrain from putting any makeup on for 1 week following surgery. I tell people that they can start using an SPF 50 sunscreen, a mineral sunscreen with zinc oxide or titanium dioxide, generally on day 5. So this has been a short Q&A on facelifts. I hope I've answered some of your questions. If you have any more questions, just comment on the video. You can DM me personally and I'll get back to you, or you can give my office a call. We'll put the number in the comments. Thank you so much for tuning in, and wait until next time.